Good afternoon. We'll now start. I'd like to make some reminders. But before anything else, I'd like to welcome everybody to this particular pep talk. Please mute yourself, but always show your video picture. Sign in your name, Facebook account, or email address in the chat box. Please include the names of companions attending. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. So please show your beautiful faces in the video when we do the picture taking. Another reminder is that after the pep talk, please take the online learning evaluation test exercise or OLETE for mastery of learning and have a perfect score to get a certificate. The link, I placed the link in the chat box. This is the picture of the certificate that one can get after getting a perfect score on the OLETE. And then another reminder, 50 OLETE certificates would entitle one mentee to a free voucher for a ROJoson telemedical consultation. Another request is please place your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please show your beautiful faces. One, two, three. Okay. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. As shown here, these are the contents of the core courses. From October 23, 2021 onwards, I have been tackling health disorder and health issue courses. This may take 3 years or longer depending on our enthusiasm and perseverance. My pep talk today is entitled Cancer Awareness and Myth on Treatment. This is part of my contribution to the National Cancer Consciousness Month program of the DOH, which is allotted for February. Last week, we had a pep talk on cancer awareness and myth on causation. But this time, we will be talking on the myth on the treatment. The empowerment objective is for the lay people to have a basic understanding of what a cancer is and its associated myth on the treatment. The contents of this talk will be the following. So basic topics: what is a cancer? What are the different types? And then what are the treatment? Before we go to the myth and misconception on the treatment and prognosis. When I say prognosis, I mean the forecasting of likely outcome, yung mga mangyayari na outcome of the cancer with and without treatment. Okay. So let's start with the first basic topic, which is what is a cancer? Cancer is a medical disease when some, and not all, okay, and some of the body cells grow uncontrollably with a potential to invade the adjacent body tissue or organs and to spread spread to distant tissues and organs. So this illustrates the normal cells. That if there is a cancer, there is uncontrollable growth of these normal cells. Start with one cell. One cell is enough to cause a cancer. Abnormal growth of one cancer, then multiplying into several thousands, millions of cancer cells, and then with tendency to invade the surrounding tissue. Okay, here surrounding skin, surrounding fat. It also has the potential to spread to distant areas like the lymph nodes and also the lungs, okay, bones, mga distant organs, the brain. So this picture shows the original tumor is on the colon, okay, and it has spread to the lungs. So that's what is meant by spread to distant organs. Okay, in this particular case, it spread to the lungs, and the technical term here is metastasis. Okay, metastasis. Okay. So sometimes before it spread to the distant organs, it can spread to the lymph nodes first, then to the distant organs, and sometimes it omit the spread to the lymph nodes. It goes direct to the distant organs. Before going further, let me clarify one associated term of cancer. We commonly hear the phrase malignant tumor. Malignant ba yan? And try to differentiate it from the so-called benign tumor. When you say malignant tumor, it's the same as cancer. And what is a benign tumor? A benign tumor is not a cancer. Malignant tumors invade and spread, whereas benign tumors do not invade or spread. So that's the basic difference between the two. Now, what are the different types of cancer? There are more than 200 types of cancers. More than 200, marami yan. Okay? Okay. So the type of cancers can be categorized into whether solid or liquid. That's number one, categorization of the types. And then based on the organ or tissue of origin, and then in more detail, based on the specific cells of origin. Okay. So it starts first with, is it a solid or tumor or liquid cancer? When you say liquid cancer, it's basically the blood cancer. So, okay, so fluid cancers, okay, blood cancers. In contrast to solid cancers, which are those tube cancers involving the various organs like the breast, like the bone. Okay. So both types, whether liquid or solid cancers, are similar in that they made up of abnormal cells. So may abnormal cells sa blood, may abnormal cells sa solid organs, and then they grow uncontrollably. Hindi makokontrol ng katawan. So, and then the solid tumors, they form masses, bukol, okay? And the liquid tumors, hindi natin nakikita yung bukol, pero liquid kasi yung mga cancer, they just circulate around the body through the bloodstream. So hindi nakikita ito, no? Okay, as a bukol. Yung liquid, yung mga blood, example will be the blood cancers. Another type of categorization for the different types will be based on the organs of tissue of origin. Medyo madali lang ito, no? So if the cancer arises from the breast, we call it breast cancer. From the brain, brain cancer, bone cancer, etc. Okay, based on the organ or tissue of origin. So let me put a note here that no organ in the body is spared of cancer, meaning all organs in the body, yung buong katawan natin, okay, pwedeng tamaan ng cancer. Some are common, some are rare. So yung mga rare na cancers will be cancers of the heart, so meron din, pero very, very rare. Then cancers of the spleen and also the appendix. Okay. The other system of categorization of the type will be based on the specific cell of origin. Kaya kung minsan naririnig kayo, adenocarcinoma, basal cell carcinoma, okay? So different types of cells in one organ. Sabihin natin sa stomach, sa esophagus, no? So if it arises from the gland, yung mga nagsisecrete na mga mucus, you call that adenocarcinoma, okay? If it's coming from the lining, just the lining of the 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 stomach, gastrointestinal tract example will be squamous cell carcinoma. O kaya sa skin. Sa skin, maraming types of cancer. Some will be basal cell, some would be squamous cell, okay, etc., etc. No? Okay. So based on the specific cell of origin. Mas detalye nito. So we start first with, is it a blood cancer or liquid cancer, or is it a solid cancer? Then after identifying whether it's solid or liquid, then you try to see, is it coming from the bone, from the breast, etc., etc. And then more detailed, anong specific type of cancer in that particular organ. What are the treatment of cancers? So we will discuss this a little bit because our main focus today will be the meat on the treatment. Okay? What are the different types of treatment? There are many types of treatment, and this will depend on the type of cancer and how advanced it is. Basically, these are the two factors that will determine the type. Okay? So some people with cancer will only have one treatment. Isa lang gamutan, let's say gamot, is operasyon or radiation. Okay? But most people have a combination of treatment, such as, example, surgery, followed by chemotherapy and radiation therapy, or kumisan chemotherapy followed by surgery and then radiation. O kumisan dalawa lang, surgery then chemotherapy without radiation. So these are examples of combination of treatment. The most common mainstream cancer treatment, so I will not talk about the alternative treatment. Mainstream means the conventional, okay, most frequently done, okay, surgery, radiation, chemotherapy. Others will be hormonal, targeted therapy, and immunotherapy. Surgery is used to treat cancer. Okay. And when it's used, it's a procedure in which you operate, we just use the layman's term, remove. We remove the cancer manually with instruments. Okay. So that's surgery. And then in radiation, you use high dose of radiation. Ito nag-emit ng radiation dito, okay, to burn, okay, instead of removal, you burn. Basically, it's burning the cancer cells and shrinking the tumors. Okay. In chemotherapy, you use drugs. Drugs ang ginagamit dito to kill the cancer cells. Hormonal therapy, you slow or stop growth of yung mga organs na may na-influence ng mga hormones, like the breast, usually influenced by estrogen, progesterone, mga hormones. Prostate is also influenced by hormones. Then you use a hormonal therapy to slow down or stop the growth of those tumors, okay, in the breast or prostate or other organs that use the hormones to grow. Immunotherapy, you help the immune system fight the cancer. You try to build up the immune system to fight the cancer. Now, for targeted therapy, it's used to target the changes in the cancer cells. Yung mga nangyayari sa cancer cells, ita-target ng gamot, and then that will try to avoid, to stop their growth, to stop their division, and stop their spread. Okay, so this is more, mas malalim na yung target nito at the cellular and the molecular level. So let's now go to the myth and misconceptions on the treatment and prognosis of cancer. So most of the misconceptions are often rooted in outdated theories, yung mga sabi-sabi at walang katotohanan. No? So they can cause undue stress and interfere with effective treatment. So kung di natin alam yung mga myth na yon, so we try to follow, okay? And sometimes we're confused also whether to follow or not. So it causes a lot of anxiety and stress. So here are some of the common cancers on the myth on treatment and prognosis with some evidence-based formation. I just called all these myths from the literature. Okay. Some will be coming from the National Cancer Institute in the USA, and some from Mayo Clinic, some Cleveland clinics. I'll just show you the references later on. Okay. But before continuing further, when you say misconception, it's a belief, okay, that there is no strong evidence to support it. Okay. So this is our operational definition of a myth. Okay, walang strong research evidences to support the belief, the thinking, the perception. So the first myth that we will tackle is cancer a modern disease? The reality is that cancer has been known for thousands of years, even in the time of the mga ancient Egyptian and Greek physicians have been reporting that. So in a way, it's not a modern disease. And one of the biggest reasons why cancer is a lot more common these days is mainly due to a combination of longer lifespan and more information. So mas marami tayong nakakaalam, no? So we also are able to diagnose more cancers than before. And then the other factor is mahaba kasi buhay ng tao compared to those in the ancient times. Okay? Baka 10, baka 30 years lang sila. Tayo, umaabot na tayo na ngayon, mga 70, 80 years old. So with longer lifespan, we're exposed to some mga carcinogens, yung mga factors that will produce cancer. So it's not true that cancer is a modern disease. Nung Asia, in mga 2000, baka BC pa, BC, before Christ, andyan na yan. Okay. So age is the biggest risk factor for cancer. And as technology has improved, people's lifespan has gone up. The average lifespan nowadays is about 70 or 70 plus or minus 3 or 4. Okay. That's the average for the entire world. Now, in the Philippines, the average is about 70. The latest report is 72. Okay. Several years ago, it was 70. Ngayon, tumataas na. No? Okay. So as we age, the chance that our cells may develop cancer increases due to DNA damage over time. Habang we live on this earth, marami tayong exposure to a lot of mga environmental factors, no, and other factors that will cause damage to our genetic makeup. Okay. So in addition, the other factor is more information about cancer and more techniques allowing for diagnosis, early detection. Okay, so and more people are aware of cancer. Kaya akala natin it's a modern disease. Okay? So in the past also, past centuries, it was normal for people to pass away, to die. Sabihin natin old age. Baka yung even ang naririnig ko, yung si Queen Elizabeth, no? When they come out with the death certificate, initially old age ang nilagay. Pero strictly speaking, baka may hidden information, she died of a cancer. Okay. So the real cause of the death is never found because they just put old age before. Okay, now we try to be more specific. We identify the specific cause. Okay, kung cancer, cancer. Okay. Now, while it is true that some aspect of modern life, in modern life kasi natin, we're maraming tobacco smoking, processed foods, and inactive lifestyle, di nag-exercise, no? So all this can also contribute to the development of certain cancers. But it's still inaccurate to claim that cancer is a modern disease. Okay. The second myth is cancer a death sentence. Okay. So the answer here is not always. Okay. So with early diagnosis and treatment, there are a lot of patients who have outlived their cancers, meaning dying from other causes. Outlive means they die from other causes. Alam naman natin, lahat tayo mamamatay, but which one will be the cause? If you have cancer and then you die of other cause, that's possible. So we say that you did not die from the cancer, but die from, let's say, heart attack. Okay. And there are a lot of patients who have lived for more than 30 years with no recurrence. More than, it could be 40, 50. No? So how long an individual cancer patient will live and whether he or she will die from the disease depend on many factors, including whether this cancer is slow or fast growing. Yan ang pinaka number one. We have to determine, pero mahirap i-determine kung yung isang cancer is mabagal o mabilis tumakbo. Only time will tell. Okay? So the other factor is how much the cancer has spread in the body, kung advanced na or still early. and whether effective treatment are available. Okay? Kung meron pang mga nowadays a lot of treatment are being done for cancer, no? Pero there's still some the so-called rare cancer diseases na wala pang treatment, no? Okay. And then the other factor will be the overall patient, the person's overall health. Kung malakas pa siya, kung marami siyang sakit. So kung mahina siya, so most likely she will not live long because of the cancer. No? But kung malakas siya, kung kahit na may cancer siya, no, baka tumagal pa siya. No? So that's another factor to consider. Third myth, this is the third, there is no effective treatment. Okay. So is that true? There's no effective? Well, probably the answer will be, if the cancer is diagnosed and treated early enough, it greatly reduces the risk of cancer spreading, kasi na-control na, and then prolong the survival, and in many cases causes all signs of symptoms of the cancer to disappear. So in which case, we call that the treatment is effective. But if the cancer is diagnosed and treated late, then the effectiveness of the treatment is less and not effective anymore. Okay, so there's no absolute truth to the no, there is no effective treatment for cancer. Meron. Okay, so it all depends. Kung diagnosed early, treated late, diagnosed and treated late, then the effectivity will be compromised. There is no cure for cancer. It is true that we physicians don't talk or guarantee cure after a treatment of cancer because of the potential for recurrence of all cancer. But in reality, cancer patients can have cure after treatment. Okay, especially those who have slow growing at na-control na, and then who have been living for 10, 20, 30, 40 years na. So chances of recurrence, maliit na lang, so we can say that they are cured already. Physicians use the word remission. Ginagamit ng physicians, not kung tinatanong ng physician, may cure ba ito? Sasabihin niya, wala. But you can have remission. No? To mean there is no, remission means there's no evidence of recurrence at the time of the examination. So these remission states may mean also cure for the patients. Example, when I say you have cancer, you have no recurrence, no remission for the past 20, 30 years, then strictly speaking, you can say most likely you are cured of cancer. Okay. So in reality, cancer patients can have a cure after treatment, especially those with slow-growing cancer and cancers treated in the early stages. So what's the difference between cure and remission? A cure means that the cancer has gone away with treatment. No more treatment is needed, and the cancer is not expected to come back. So this is cure. As I said, it's rare that a doctor can be sure that the cancer will never come back. So in most cases, it takes time to know if the cancer might come back. Only time will tell. But the longer the person is cancer-free, the better the chance the cancer will not come back. And more often, when treatment appears to be successful, doctor will say the cancer is in remission rather than cured. They just want to play safe. Ayaw nilang masabit sila. But deep inside them, they will say, most likely you're cured if you have a slow growing, and then you were treated in the early stage, and then yung remission mo has already been long, 10, 20, 30 years. Okay. And a realistic and practical definition of cure will be the following. Okay. A patient with a particular cancer in remission or cancer-free, okay, when you say remission, cancer-free, okay, at the moment, okay, for a period of time that is usually known to have the least chance of recurrence for the type of cancer this patient has. Okay. Example, if the known track record, okay, has a least chance, let's say 1% of recurrence for a cancer A is 10 years. Kung yung cancer A has a track record na pag naka 10 years na siya, 1% na lang, then you can say that that patient with that particular cancer who has a remission of 10 years or more can realistically be said to be cured. The other myth related to the other two will be cancer always come back. Okay. Not always. Although there is always a possibility that the cancer can come back or recur, it does not always come back. And the likelihood of recurrence will depend on these factors: the type of cancer, how fast it grows initially, and then how advanced it was when the doctors first discovered and treat it at the time. Okay? So the general principles to follow, to know, is that the cancer diagnosed accurately and treated early. Okay, I repeat, cancer diagnosed accurately, dapat accurate, no? And then treated adequately, yung wasto, tama lang, na, adequate. And then, early, have a lesser chance of coming back after treatment. So diagnosed accurately, treated adequately and early, then have a lesser chance of coming back. Another myth is some would question is if we can put a man on the moon. Alam natin, sila Armstrong nakaabot na sa moon. So how come we don't have cure by this time? No? Okay. So the truth is that finding the cure for cancer is proving to be more complex than mastering the engineering and physics required for space flight. Sa tao kasi, sa biological aspect of the human body, ang hirap mag-predict, no? And then the other compounding factor is that cancer actually includes a large group of diseases. Sabi sa'yo, there are there are more than 200 types, okay? And each person's cancer may have different causes, iba-ibang causes. For the same cancer, they can have different causes. And despite the advances in diagnosis and treatment, doctors still have much to learn about which that triggers a cell to become cancerous and why some people who have a cancer do better than others. So marami pang hindi natin alam. So cancer is also a moving target. Cancer cells may continue to mutate and change during the course of the disease. Okay? So let's say nag-mutate na ngayon, naggamot na, and then over time, as time goes on, pwede pa rin mag-mutate ulit. So when this will occur, nobody knows. Okay? So this may lead to the cancer cells no longer responding to the chemotherapy, drugs, or radiation treatment that were given initially. Yan nagbabago. Okay. It is easier to remain unaware you have cancer. There's a tendency for a lot of people to adopt this attitude. Wag na lang malaman para ano. Okay. Sabi nila, porke pa, wala namang bumabalik naman at walang magandang treatment, di ba? So, you should not ignore the symptoms or signs of cancer, such as a breast lump or a more abnormal-looking mole. Although the thought of having cancer is frightening, nakakatakot, you have to talk to your doctor and get a diagnosis. Okay? And then this will give you the power to make an informed choice and seek the best possible cure. So kung kinausap niyo yung doctor, maganda pala yung prognosis, kung tatanggalin, hindi patanggal mo na, kaysa hindi mo just ignore it, sabi mo, ay, bahala na, ngayon pala, it's a slow growing one, but lumalaki, but by the time you decide to have it treated, baka too late na. Because treatment is usually more effective during the early stages of cancer, kaya mas maganda i-consult na kagad. So an early diagnosis often improves person's chance for survival. And the ignoring a serious problem like cancer will not make it go away. So don't be in a denial. Harapin na natin yung problema. Okay? But early detection of almost all cancers vastly increases the chance of a successful treatment. And that's a fact, okay? Borne out by the evidences. Early treatment, early diagnosis, better chance of survival. If you are old, kung matanda na, maraming nagtatanong nito sa akin, okay? There's no reason to treat cancer because it won't do any good anywhere. Matanda na eh. No? So age should never stop anyone from seeking treatment for symptoms or any illness as soon as possible. One is never too old to be treated for any illness. So this applies not only to cancer, but for any type of disease. I-diagnose muna. Kung maganda ang chance na magagamot pa, pagamutin pa, no? Kaysa pabayaan na lang. Okay? Plenty of elderly patients are still cured of early stage cancer and enjoy years and decades of additional life. Yung mga 80 years old, na kung may breast cancer, kung pwede pang tanggalin, patanggal pa. Baka umabot pa siya ng 90, 100. No? Okay. Kaysa you just leave it alone, let it grow, and then the patient will just probably develop advanced diseases within 3 years, baka mamatay siya within 5 years. Okay. So if the cancer is advanced, okay, kaya importante yung diagnosis at that time. Right? So then, if yung cancer, kung advanced siya, then we just have to balance the benefit and the risk. Okay? Kung advanced na, pwedeng wag na lang muna o wala ng aggressive treatment, no? Kasi advanced na. No? Okay. Everyone who has cancer has to have treatment. So, ito naman, hindi namin pinipilit as doctors. No? We want to say, everyone who has cancer has to have treatment. So, because of the patient empowerment, because of the patient-centered care, we leave the decision to you. Okay, so it's really up to you whether you want to treat your cancer. Kasi ikaw magde-decide sa buhay mo, di ba? So you can decide this, but decide this after consulting your doctor and learn about the options. Wag lang sabihin na, oh, I have cancer, I would not like to have it treated anymore. No? Okay. Or basta mag-consult lang and then try to get the opinions of the doctors. Everyone who has cancers have to have treatment. Same topic here. Okay. The person who has cancer might choose to forego. You have the right to forego your treatment if you don't like to. And these are some of the situations that can happen in this particular issue. A slow-growing cancer. Some people who have cancer might not have any signs and symptoms. Lab tests might reveal that the cancer is growing slowly, very, very slow. These people might choose to watch and wait the cancer. If it suddenly begins growing more quickly, then treatment should come in already. So what is an example of a slow-growing tumor? Example, kamisan yung mga maraming example dyan, pero mahirap maintindihan. So yung kumisan yung thyroid papillary CA, very slow growing, maliit lang, no, microscopic. You can just watch and wait. Okay. So o kaya kumisan yung isang cancer dito sa skin, yung basal cell na maliit-maliit, no? Okay. So you can bantayan lang, and then kung lumalaki, then tanggal. Okay. So those are examples of situations. Slow-growing tumor, there's options for watch and wait, but talk to the doctors. Okay, it all depends on the type of the cancer. So the other factor that will determine the decision on whether to forego or not is that if you have other significant diseases, you may choose not to treat your cancer as the cancer might not be the biggest threat to your life. So let's have example. Meron ka ng heart attack o kaya meron ka ng stroke na you might die within 2 years. Ganoon. So if you have a cancer like, let's say, skin cancer, you may forego the treatment for that, no? But just focus on the more urgent one. So this may be especially true in case of slow-growing cancer. Late stage, kung talagang advanced stage na, okay, you may choose not to. Okay, we will respect your decision. If the burden of the treatment side effects outweighs, mas malaki, the benefit that the treatment can bring, you may choose not to be treated. Okay, so it's your decision, the family's decision. Okay, but they have to be advised properly by the doctors. You get all the pros and cons, all the data, all the statistics, no, to guide you in your decision making. Kaya tayo may mga patient empowerment program like this. Okay. But that does not mean your doctor will abandon you. The doctor will still be with you, trying to guide you. Okay, so to provide the comfort, and then kung hindi na kailangan, hindi pwedeng operahan, wag na operahan, they can still provide some pain relief. Superfoods prevent cancer. Ito yung pinaka very common, this is a very common belief. Okay. So some foods like blueberries, beer fruit, broccoli, garden, green teas are known as cancer-preventing superfoods. Yung mga naririnig natin, nababasa natin. So these foods certainly are good for the health of the body. Okay, they have positive side effect. Okay, they probably contain yung naririnig natin, antioxidant, no? Nag-remove ng toxins sa body. Okay. However, it would be naive to look at any particular food as protection against cancer. Number one, everybody is different, and cancer reacts differently in every person, iba-iba. At the moment, there is no single food or food group that can provide enough protection against cancer. So this is based on the evidences. So no single food or food group that can provide enough protection against cancer. So wag kayo don't be sold on the yung mga nagtitinda ng mga superfoods. Okay. So if you want to read more on this, just look at this particular article, 10 persistent myth debunked, okay, in the UK. In England ito. Are there herbal products that can cure cancer related to the superfoods? Okay. Again, the answer is no. Although some studies suggest that alternative or complementary therapies, including some herbs, may help patients cope with the side effects of cancer treatment. Okay, yung pwedeng magbigay to lessen the side effects of, let's say, chemotherapy. Okay, but using it as a treatment for cancer, hindi siya effective. Okay. So in fact, some herbal products may be harmful when taken during chemotherapy and radiation therapy. That's why ingat lang kasi lahat ng gamot, lahat ng pinapasok sa katawan may potential side effect. Okay? So, and also they can interfere with the cancer treatment. Okay? Cancer patients should talk with their doctors about any complementary or alternative medicine products, including vitamins. Vitamins, pwede din karoon ng side effects, no? And herbal supplements. Will eating sugar make my cancer worse? Will stopping sugar make the cancer smaller? Okay. The answer is no. Although research has shown that cancer cells consume more sugar, glucose than normal cells, ito yung probably origin of the myth, okay? But no scientific studies have shown that eating sugar will make your cancer worse, or that if you stop eating it, magsishrink or mawawala yung cancer mo. Okay? So it's not true. A needle biopsy can disturb cancer cells, causing them to travel to other parts of the body. For most types of cancer, there's no conclusive evidence that a needle biopsy, a procedure used to diagnose any type of cancer, yung tinutusok na kumukuha ng sample, no? So there's no conclusive evidence that this would cause the cancers to spread. Okay. Yung exceptions, though, may konti lang. Very rare nga ito, no? Rare. Okay. So a needle biopsy isn't usually used in diagnosing testicular cancer. Probably yon. Yun ang may mga scientific evidence. Baka pag tinusok mo yung testicular cancer, baka mag-spread. So usually the doctor just remove the testicle once they diagnose. Once they suspect cancer, just by examination without the biopsy. So there's more benefit in doing a biopsy than not doing, because you need a definitive diagnosis. So the most common way of trying to get to the definite diagnosis is still a biopsy. Yan ang tinatawag na gold standard, no? Okay. So yung kumisan yung mga imaging procedures like ultrasound, they can help in the diagnosis, but in the end, you still have to get a biopsy to be very, very definite about the diagnosis. Surgery causes cancers to spread. The chance that surgery will cause cancer to spread to other parts of the body is extremely low. Okay, this is also connected to the earlier topic, needle biopsy. Okay, very, very low. Don't delay or refuse treatment because of this myth. So the doctors will tell you which is what is the score, whether you should have the biopsy or not, whether it will create more harm or not. Okay. So surgically removing a cancer is often the first and most important treatment. Some people may believe this myth because they feel worse during recovery than they did before surgery. Kaya naniniwala sila dito, kaya ayaw nila magpa-opera. Okay? Cancer is always painful. Some cancers may never cause pain. May mga cancers na walang sakit. Usually, pag yung mga surface like breast cancer, usually hindi masakit sa umpisa yan eh. Pag umabot na ng skin, kinakain na yung balat at pupunta na sa bone, then you have pain. So for people who do experience cancer pain, especially those people who have advanced cancer, doctors have become aware of the need to control such pain and have learned better ways to manage it. Although all pain may not be eliminated, especially those advanced cancer, the goal is to control the pain so that it has little impact on your daily life. Cancer treatment is usually worse than the disease. Although cancer treatment such as chemotherapy and radiation therapy can cause unpleasant, maraming side effects, okay, serious side effects, recent advances have resulted in many drugs and radiation therapy that have more manageable side effects. So scientists are continuing researching to lessen all these side effects of the drugs and also the radiation. Surgical treatment is also associated with side effects of pain. Sigurado man may pain pag naoperahan because surgery is just like inflicting a wound, but it's a planned wound, okay? And then, kumisan, kadalasan may tinatanggal ng mga body tissues like mastectomy, di ba? Okay, those are the side effects of the treatment, but it's in exchange for a long survival, okay? So, if you do surgery, the post-operative pain can be controlled by analgesics. And the loss of body tissues, isipin mo na lang, kung may natanggal sa iyo, nabawasan ka, this is in exchange for a better chance for survival. Okay, so we try to balance the benefit and risk and then make a decision. Should it be removed totally? No? Ang kapalit nun, better chance of survival. Kung maliit ang chance of survival, wag na lang tanggalin. No? A positive attitude is all you need to beat cancer. Okay, meron ding naniniwala rito na okay, basta I'll just have a positive thinking, palaging positive thinking, it will just make my cancer go away without having it treated. Mali yun, no? So there's no scientific proof that a positive attitude gives you an advantage in cancer treatment and improves your chance of being cured. What a positive attitude can do is to improve the quality of your life. No? During the cancer treatment, kasi may positive attitude ka, may fighting spirit ka, okay. You may be more likely to stay active, maintain ties to family and friends, and continue your social activities. So in turn, this may enhance your feeling of well-being and help you find the strength to deal with your cancer. Okay. So yung attitude is not, you cannot rely on the positive attitude to treat the cancer. Regular checkups and today's medical technology can detect all cancer early. Maraming tao na rin nagpapa-check up. Ang dami-dami kalahat, no? There's no assurance, no? Akala nila may makikita lahat, no? Okay. Although regular medical care can indeed increase the ability to detect cancer early, okay, although pwede, it cannot guarantee, no guarantee. May mga false positive, false negative, okay? So, and also cancer is a complicated disease and there's no sure way to always spot it. Kanisan maliit na maliit lang, hindi mo talagang makikita. No? Routine screening has been linked to decrease in death from cancers of the prostate, cervix, breast, colon, etc., etc. Okay, it's true that routine screening can decrease it, but you should take note that it cannot, it doesn't offer guarantee that you will detect it all the time, 100% all the time. If I'm not offered all the tests, yung mga tests na naririnig natin, na lahat, no? Treatment available, Does it mean that I'm not getting the best cancer care? No? Okay. Not every test, treatment, or procedure is right for every person. So iba-iba yung mga pasyente, iba-iba yung need nila. You and your doctor should discuss and which one will increase your chance of recovery and help you maintain the best quality of life. You should also discuss which ones will increase your risk of side effects and lead to unnecessary costs. Okay. So yung tinuturo ko sa inyo, BRCA, okay? So benefit, risk, cost, availability, we try to get all the data on those 4 parameters and then try to evaluate and then make some decisions with the help of your doctor. So if you decide after the discussion with your doctor, and then if you need more information before treatment, okay, so you can always, there's an option that you can ask a second opinion. Okay? You have the right to seek a second opinion. Everyone who has the same kind of cancer gets the same kind of treatment. Mali, no? Okay, it's not true. No such, as I said, doctors, cancers are of different types. Okay, different persons have different types, different behaviors. Okay, so the doctor usually tailors, okay, ina-adjust niya yung treatment to you based on the type, based on the behavior of your cancer. Okay, so what treatment you receive depends on where your cancer is, bone, lungs, prostate, okay, whether how much it has spread, advanced early, how it's affecting your body functions, okay, your general health, kung malakas ka pa, and other factors. So walang same treatment for the same kind of cancer. Example, breast cancer stage 2, no? Kumisan, iba-iba pa rin ang treatment. Although majority will have the same kind of treatment, pero hindi lahat, no? So it all depends. Cancer is the name given to a group of diseases with a common trait of uncontrolled cell divisions which can spread to the surrounding tissues. Not only are there over 100 types, sabi ko 200, now 200 types, but each cancer reacts differently in different people. Even in people with the same type of tumor, okay, same breast cancer, same specific type, invasive carcinoma, the same body parts, different types of genetic changes can also affect the cancer. Okay, some are born with a gene that will make their cancer grow faster or slower. So that's why the treatment should be treated differently. And this is the reason why a super cure for cancer is very unlikely. So probably those who are undergoing alternative medicine, they parang may mga cure-all using one concoction for all types of cancer. Hindi tama ho yun. Huh? And why even the best combination of treatment nagka-fail pa rin. Okay? Nagkakaiba. Okay. A successful cancer treatment often needs a dedicated and experienced medical team to explore the options and map out the ideal path to recovery and also close monitoring, lifetime monitoring, no? Kasi nag-iiba, iba ang takbo, no? Ng yung cancer. Okay. Takeaway. Summary takeaway, I have discussed what is a cancer, what are the different types of cancer, what are the treatments, and I have discussed also the myth and misconceptions of treatment and prognosis. Okay. I won't repeat all this anymore. Okay, just take a quick look. I discussed all of these items. Takeaway in relation to cancer empowerment. Be always in touch with reliable medical information on the myth in cancer treatment and prognosis. Knowledge is power, it gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in preventing the myth of in cancer treatment and diagnosis, in affecting your health management, in preventing the myth from causing stress and then causing you not to have to go for a effective treatment. So with this, I end my pep talk today. Cancer awareness and myth on treatment. I hope I have empowered you to have a better understanding of what a cancer is and its associated myth on treatment. Before we go to the QA, reminder, please take the OLETE. 50 OLETE certificates will entitle one to a voucher. We're now on our 85th or 84th pep talk. So you have 84 chances of getting at least one 50 OLETE certificates. Yung iba nag-avail na dyan. Okay. And then feedback to this pep talk, please type in your feedback in the chat box, okay, during the open forum and before we adjourn. Okay. So let's now have a group picture taking before we start the QA. Okay, ready? 1, 2, 1, wala nang habol. 1, 2, 3. Okay, the floor is now open for open forum. Comments, sharing of experience. Any questions that you might want to ask?
Hi, Doc.
Is that Cherry talking? Cherry? Cherry?
Nakausap ko si Ma'am Ridis. Na-mention ko sa kanya na yung siguro due to tamoxifen. Nagkakaroon ako ng brittle hair ngayon. Tapos nagkakaroon ako ng brittle hair. Tapos hair loss.
Brittle hair. Brittle hair.
Opo.
Okay.
Brittle, oo. Hindi ko sure. Last month naman, hindi ko siya napansin. Pero this month, parang masyado nang buhok ko parang parang wala na siyang life.
Okay. Pero hindi ka naman nakakalbo.
Ay, sana hindi naman. Kasi kahapon ko lang siya na-notice na parang nag-dry up na yung hair.
Okay. So you want to stop it for a while or you can still observe it. Anyway, hair lang naman yan eh. It's not life-threatening.
Pero Doc, pag ganyan, hindi ka pwedeng mag-take ng mga fish oil, gano'n.
Kasi number one, we have to know the cause muna eh, di ba? A lot of times we don't know the cause, no? We still don't know whether it's caused by tamoxifen. It could be other cause. Kasi meron din mga ibang tao na without tamoxifen, suddenly nagkakaroon ng problema sa hair, di ba? Okay. So one thing is just to observe and then, kasi sa 2 days pa lang, di ba? 2 days pa lang.
Itong week lang to.
Pwede mo bang i-observe mo na? Okay.
Sige.
I hope, kumusta na yung mo? FDM, walang kinalaman doon?
Hindi ko sure do kung meron o wala. Pero kasi itong nagkasakit ako, mas marami akong fluid intake. Pero nag-hair loss siya. Hindi ko sure kung meron bang connection yun.
Okay. So ang suggestion ko, i-observe mo na lang. Anyway, it's not life-threatening. No?
Oo.
Okay.
So, yan ang mga Doc. Yan ang mga concern ko. Yung skin ko na nagda-dry.
Okay.
Papansin.
Kasi at the moment you have some illness, baka it might affect also yung what's going on. No? You just observe, but nagre-recover ka na, di ba? You're on the way to recovery.
Apo.
Okay?
Apo. Okay. Sige, Doc.
Any comment on the alternative medicine?
I suggest you use rosemary oil para ilalagay doon sa iyong scalp. Kasi ako din manipis ang buhok. But I use coconut, yung virgin coconut oil. Pero some others use rosemary oil. Ilalagay lang doon sa scalp.
Sa scalp. Meron ako rosemary na na oil. Kaso lang parang super siya yung 100% pa. Hindi pa siya diluted. So baka may pag naglagay ako, baka matapang masyado.
Doon sa mga part na manipis. Not throughout the head. Doon lang sa mga spot. I don't know.
Kasi yung rosemary ko, hindi pa siya diluted eh. Parang pure pa. Yung young, young living. Di ba matapang yun?
Kaya
okay lang kaya. Coconut oil. Sige, try ko muna yung coconut oil.
Virgin coconut
Oo nga
oil.
pala, no?
Yeah, virgin coconut oil.
Yung iba naman, cherry, yung iba naman, aloe vera. Yung plant ng aloe vera.
Oo, meron akong, sige, try ko. Nakalimutan ko na yung, yung amoy latte. Yung
that's what I'm
gawang
using.
ilagay sa hair. Nakalimutan ko yun. Try ko. Sige. Try ko.
Okay. Any more? Ako, wala akong experience sa mga hair loss. Ako natural sa buko.
Wala na. Naubos na.
Any comment? Any other comment? Questions?
Ma'am Edna, do you have anything to ask? Dr. Hosen is here. Unmute. We can't hear you. Unmute.
Sino kinakausap ko, si Edna?
Si Ma'am Edna Shepherd. She was looking for you the last time. Yan.
Okay.
Hello, Doc. So,
Yeah.
I have no question.
Oo.
I'm enjoying listening to your explanation.
Oo.
It's very educational, but so far I have no questions.
Good. So, yung questions mo last time, nasagot na ng anak ko?
Yeah, ano lang naman yun eh. Slow moving and fast moving. What's the difference? Ganun, kung meron ba. Yun.
Okay. So, no questions. Okay. So, do you agree with all the, yung present kong meet? At 20, ilang years ka na? 23 years?
For me?
Yeah.
More. 80, 91. 91, 92.
Ilang years na yan?
22.
Oh, at 22 years.
22 plus 8. No, 30.
30.
30 years na?
Yes, Doc.
Okay. So,
Thank you.
30 years in remission. Okay lang? O, sabihin natin cure
mabuti.
na. Pwede ko nang sabihin
Mabuti. Doc.
Pwede nang cure?
Yeah, pero yung isa, di ba question mark pa?
Oo nga eh. Okay.
Oh, anyway, I feel good naman. So I'm just waiting for you to tell me when to have my x-ray.
Okay. Sige.
So,
So,
anyway,
okay, let's put that aside. That's a personal matter now. So, but at age 30 years in remission, no? Let's just call it in remission. Okay.
yes.
Ano yung reactions mo doon sa sinabi kong meat?
Yeah, what?
Yung meat. Did you
Myth? Yes.
Did you indulge yourself in herbal medicine before the
Not really. I just took the somebody gave me barley green.
Okay.
Barley green capsules, which I took I think on my third treatment, my chemo. My chemo was only prophylaxis, no? So on my third chemo, instead of suffering on the effects up to the 7th day, I only felt the effect up to the 3rd day. After the 3rd day, okay na. Wala na yung dizzy, throwing up like that, wala na.
Okay.
But that's the only thing I ever took. That it is just supplements, carrot juice, apple juice, mga ano lang, healthier food.
Okay. So for the past 30 years, you're not relying on some yung mga pinopromote na herbal medicine,
No. Just taking the
natural food.
the supplements, nutritional supplements, vitamins.
Okay.
Lang.
Vitamins. Okay.
Nothing, I think no need.
Okay.
No need to rely on those mga promotions kasi alam niyo naman, promo lang yun eh.
Okay.
Diba?
Let's
Obvious.
ask, okay. So you're taking vitamins, sabi ko, hindi kailangan, di ba? To protect you.
Yeah.
But,
Yeah, you said no need for vitamins, but I feel insecure without vitamins.
Okay.
Parang
So
hindi kaya ng katawan ko. I think my body needs vitamins.
Okay. So let's ask Aida. Si Aida is here. Aida? Are you taking vitamins, Aida?
Yes po.
Okay. So you think your vitamins help you in nakailang years ka na? 33 years?
35 po ngayon 2023.
Okay. So you think your
35 years
vitamins
in remission.
you think your vitamins help you in remission?
The B vitamins po kasi nga yung minsan masakit yung mga nerves.
Okay. Yung mga for the nerve, no?
Yes, for the nerves po.
But not really intentionally targeting yung mga cancer recurrence, gano'n. Hindi.
Di po. Dahil po sa tumatanda na, yung mga pasma-pasma, masakit wala naman kahit ginagawa, so masakit po. So, yun po. And Doc, nice to be back.
Oo nga.
Sorry po, busy sa church.
Okay.
Nachi-chempong Saturday.
Okay.
And hindi ko tuloy alam kung saan yung hahabulin ko.
Welcome back.
Marami po yata akong hahabulin na
Yeah.
na ulete.
Yeah. Okay.
Lang po, Doc, tingnan ko po kung saan po ako na-stop.
Yeah.
And then kasi pagpasok po ng November, kasi po back to normal yung sa church. So sorry po. Pero ngayon, libre ko ngayon.
Sige, I'll send you the list. Okay.
Okay, thank you po, Doc. Nice to be back.
So anybody want to comment on the vitamins?
Gigi Alvarez is in the house.
Si Gigi.
Yeah.
Gigi,
Hello, Doc.
welcome back, Gigi.
Hi, Doc.
Any comment?
Ako, Doc, I take hyaluronic acid for my sumasakit yung paa ko. I went to the doctor and then sabi niya it's a spur. So he's letting me take hyaluronic acid and collagen complex.
Okay.
Sa paa. And then also vitamin B. So yun lang for my feet. Baka aging.
Okay. But not for breast cancer. But not
Hindi po.
Okay.
No.
Yeah, aging lang yung osteoarthritis. No?
Parang kung may spur ako sa above the heel.
When you have spur, that's a sign of osteoarthritis.
So tama ho yung hyaluronic at saka collagen?
So diagnosis is osteoarthritis sa paa, kanan?
Above the heel po both. Both. Para siyang may
Okay. So
it's a spur. Spur daw spur.
So is it severe? Talagang di ka makalakad?
Ngayon, better na ho, nakakalakad naman ako. So I was told not to kasi during the pandemic, parati ho naka-chinelas, naka-flat shoes. Wag daw ho mag-flat. So I'm using if I have to wear rubber shoes or it cannot be flat. It has to be with yung parang may sa loob.
Okay.
Yeah, or my shoes cannot be flat daw. Okay. Para siyang namamaga, Doc, yung spur It's parang parang swollen.
Yung spur naman hindi na mawala yan Diyan. Okay.
Yeah. So okay lang
Tingnan
yung
mo.
doc, yung hyaluronic at saka, hyaluronic acid.
Hindi,
And
one way, kasi ang tanong sa akin kung okay ka lang uminom, well, kasi sabi ko sa'yo, may options ka rin, you don't have to take it.
Okay.
Okay,
Okay.
so you have the options not to take it. That's why you just have to balance everything, no? So, walang gamot, will it go away? Will it, with, let's say, with yung non-medication treatment, no? Sabihin natin, a little exercise, a little, ano, okay? So, kung minsan pa pwede rin yon, di ba? Okay? Kasi ako, I've been having this pain also on the left side, no? For the past 10 years, no? On and off, nawawala. So, I found, hindi ako nagme-medicine, no? And then, I found parang biglang last November, masakit na masakit, no? In-adjust ko lang yung mga lifestyle ko, no? May mga exercise konti, nawala, no? Until last week, bumalik na naman. Bumalik na naman, no? So almost 1 week na ito. Ngayon, pawala na naman. So I don't take medicine. I just try to do exercise. Just try to find the right combination.
Oo nga ho. Like ano po, I stopped nahinto ako mag-yoga. Now I'm going back to yoga. Baka bumalik na siya ulit. Baka ano lang. Kulang exercise. Kulang ng exercise.
Yeah, okay.
Or sabi ko nga hindi ba ho dahil na lockdown body tayo, medyo tumaba.
Pwede
Mabigat
rin.
yung.
Yeah. I'm trying to reduce my weight also. Tumataas yung weight ko na.
Yan. So we have to, yeah.
So what I'm saying is that pwede ding wala, no?
Yeah,
Exercise
wala.
lang. Okay.
Mhm.
So yung hyaluronic does not guarantee it naman. Baka the question is how long will you take it, di ba? Okay.
Yeah.
Pag tinigil mo, babalik din yan. O kaya kahit na if you take it, pwede pa rin bumalik, di ba? If you're not treating if you have not identified the real cause, mahirap identify yung cause, you just have to look for it. Yung lahat ng movement ng katawan mo, titingnan mo kung ano yung masakit, ano.
Yeah. Tapos, so I went to that doctor, parang sports doctor, and then I went to him for a few times kasi both my brother and I have the same spur sa paa. So my brother went, so sumama na rin ako sa kanya. Para siyang pinupukpok yung spur. Ang sakit. Pinupukpok. Sabi ko, ayoko na bumalik. Ang sakit. Pinupukpok yung spur. Tapos yung kanya may water daw, tinanggalan ng tubig. So I don't know that. So sabi ko, maybe I'll just try to exercise muna.
Yeah, exercise lang. No? I-balance mo lang yung, i-balance mo lang yung rest and also exercise. Rest, exercise, ganun. Balance mo.
Yeah.
Okay.
Okay, thank you po.
Okay. So, any more questions? Any comments? May anybody who wants to comment on the myth that I mentioned? Naniniwala na kayo na myth lang yon? Edna, you're trying to say something?
No. I was just going to comment on Gigi's spur. You know, Menchi, my sister, she had heel spurs for a few years. Then she had to just wear sneakers instead of flats, the ordinary flats. She was wearing sneakers all the time with arch, and then she doesn't walk too prolonged walking. Now she's fine. No more heel spurs. She wears ordinary shoes na lang. But still, she loves sneakers na. Ayaw na takot na. Insecure without sneakers. But she's okay now. I can't hear you, Gigi.
Sorry. So I have those, that's when I wear my rubber shoes or sneakers, I have to put those parang, and the sneakers cannot be so flat. It has to be the rubber shoes that's kinda with a heel. Hindi pwede flat. Yun ang sabi. Don't wear, kasi we were always wearing chinelas during the pandemic maybe, or I don't know, or, kulang lang sa exercise.
Yeah, don't worry. It's gone. She's okay now.
Yeah. Thank you.
Ano ba yung sa sol lang masakit? Sa sol?
Hindi ho, it's above the ano sa ang tawag heel, and sa above the heel. So yun, medyo namamaga siya. Yeah.
Mhm. Ewan
Yeah.
ko, kasi ako, I had a plantar fasciitis for about 1 month. Ayaw mawala, no? Until I tried yung vertical lunge, parang nag-genuflect ka, no? In 1 week nawala, no? So
Yeah.
you really have to find the right exercise, yung mga combinations, no?
Yeah. So I'm trying to yung yoga lang para hindi masyadong and then not so well my husband walks, so I don't really go with him walking na lang kasi baka mas lalo siya mamaga.
Okay. Okay.
Yeah.
Try vertical lunge. Yung
Yeah,
vertical, parang genuflect. Subukan mo 1 week kung mawala.
Thank
Okay.
you.
Any other comments? Who wants to share any concern, any special consult, libre consultation dito? Okay. So we don't have any question at the chat box, Abek?
There's nothing at the chat box.
Okay. So nobody wants to share anymore? So naniniwala na kayo sa sinabi ko? No superfoods, don't rely on superfoods, no? Just natural food na lang. And then have basta in the end, it's healthy diet pa rin. Healthy diet pa rin. Then just bahala ng what come what may. Healthy diet na lang. Healthy lifestyle. No?
Yes, so.
Ladies, you want to say something?
Wala naman po.
Okay. Okay. No more?
No more.
There are no more questions. We'll call it a day. Wala na?
Okay.
Wala na po.
Okay. Huh?
Thank you.
Thank you, Doc.
Thank you,
Sige.
Doc.
Thank you very much, Doc.
You're welcome. Okay.
Thank you, Doc.
Bye.
Bye-bye.
Thank you po, Doc. Thank you, Doc.
Thank you
Bye-bye.
po.
Thank you po.
Bye.
Thank you, Beth. Bye-bye.
Salamat, Beth.
Dr. Taker in going to Masbate.
Hmm?
Is it Masbate? Virac, Cotanduanes, or what?
I'm going to Virac tomorrow.
Ay, okay, you take her.
Travel po. Safe travel.
Ingat
po, Doktor.
Thank you, Doc.
Surgical missions yon, surgical missions.
You still operate or teach?
Operate
Oh.
and teach. Teach and operate. Teach operate.
Both.
Sa government hospital.
God bless. You're still at it, huh?
Yeah. Kaya lang masakit na yung katawan ko. Exercise pa rin.
Well, that will keep you young.
Okay.
Safe travel, Doc.
Sige. Okay,
Okay.
bye-bye. I'll see
Thank
you
you.
the next
Thank you
week.
very much.
We'll see
Bye-bye,
you the
everyone.
next week.
Take care.
Bye-bye.